Can you walk us through these?
Yeah, of course, as we have said before during the show, the key component is the energy availability. If we don't have enough availability, then we start getting symptoms that relate to that. So yeah, we can see weight fluctuations, in particular sometimes a rapid weight loss, some difficulty concentrating and dizziness, that all relates to a lack of energy essentially. When it gets really extreme, when it gets more severe, you can start seeing that affect the certain parts of your body, like your hair and nails. You can start see breakdown that is perhaps easier and more frequent. Weak. Of course, yeah. And then your heart rate starts slowing down. Your blood pressure can also become lower. Again, the body will kind of try to shut down the non-essential functions first, but you let that go on for some time, and then some of the essential functions are also going to start to get affected.
Absolutely. Now, is disordered eating something that's always intentional, or do some female athletes do this and not even realize they might be doing this?
Absolutely, yeah. It's not always intentional. Again, we have to definitely remove that stigma that if you have an issue with a female athlete triad, then you're anorexic or you have bulimia. These are known clinical disorders which are problematic, but you do not have to have one of those clinical disorders to experience the female athlete triad. Sometimes it is unintentional. Sometimes we just don't know how many calories we need, or it can be a situation in which we have changed our training, or our training frequency and intensity has increased, and we didn't necessarily think we had to change our diets or increase our caloric intake to meet the new demands. So it's not always intentional. Sometimes it relates also to our daily lives and time. You don't have maybe running from one class to the other. You don't have time to grab lunch.
Now, if you notice that you have a friend or maybe even a daughter who has, you notice that something's going on, how do you bring it up?
That's never an easy conversation to have. For example, for someone in whom you may suspect a clinical disorder like anorexia and bulimia. But I do think the most important thing is like they say, if you see something, say something. I would probably try to reach out to that person first if I had a good relationship with them. And just sometimes voicing your concerns and telling them the source of your concerns may be enough. Sometimes you may want to involve their families or even their doctor in the process.